of PMJ, currently known as, yes, Ayushman Bharat program. Actually, it has got two components. One is Health and Wellness Center, which have been established at sub center to be managed by Community Health Officer, which is a BSc Nursing graduate. And its second component is Pradhan Mantri Jan Arogya Yojana, which is actually a scheme for secondary and tertiary level hospitalization, totally free of cost for below poverty line population. And how much coverage is given through this insurance type of program? Yes, that value is asked 5 lakh per family, it's not per person, per year. Any private facility, government are already involved, big corporate setups are already involved. Wherever 10 or more patients can be admitted for treatment can become a part of Ayushman Bharat program. Yes, school health is also integrated with this program now. Absolutely. Then Anemia Mukh Bharat, what is the strategy? What is the main aim? Strategy is 6 by 6 by 6. Can you tell me what are these 6, 6 and 6? These are 6 beneficiaries. 6 interventions. 6 institutional mechanisms. Main aim or goal is to reduce prevalence of anemia by 3% per year. See, originally this program was for 5 years, 2018 till 22. Right, but of course it is carrying on. So 6 beneficiaries, 6 interventions, and 6 institutional mechanisms. Now 6 beneficiaries, they ask you exactly how much iron folic acid is given to them. So let's quickly look at that. You can revise side by side. Iron is in milligram, folic acid is in microgram. So 6 to 59-month old child, 20 milligram elemental iron, 100 microgram folic acid. 5 to 9 years, child 45 and 400. All others, it is 60 milligram elemental iron, 500 microgram folic acid. We have already discussed pregnancy lactation. Daily it is given. How long it is given in pregnancy? How long in lactation? We have discussed 180 days each. So 180 days here, 180 days here, 6 months, 6 months, absolutely. Otherwise, here it is bi-weekly. And in the other groups, it is weekly in nature, or it is given weekly. Now, for children below 5 years, logically, it cannot be a tablet, so they have kept a syrup. But when you look at other 5, they are given tablets. Where if you look, for 5 to 9-year-old child, the tablet is which color? Yes, it is pink color. It is blue for adolescents. And it is red for other things. Right, so remember, along with color coding, children below or children 5 to 9 years, pink color tablet, adolescents blue, other gets red color tablet, but children below 5 years, they get bi-weekly syrup. This program has been associated or linked with deworming program. Latest question we discussed also in the previous class, one day prior also we discussed. National Deworming Day is observed on 10th of February. If its round has to be repeated, it should be repeated after 6 months, 10th of August. Otherwise, if required, any 10th date, every month on 10th date, it could be carried out as per the requirement in an area. Albendazole in pregnancy, we say it should be done only once and it should not be given in first trimester. We don't give first trimester. Albendazole dose is same that you study in pharmacology. 1 to 2 years half tablet, 2 to 19 years we give complete tablet, 400 milligram oral stat. Poshan Abhiyan, older name National Nutrition Mission. It wants to make India malnutrition free. By 2022. Again, it was from 2018 to 22. So we know the kind of question examiner can ask. 4 diseases which are covered. We know pneumonic SULA. So we have stunting, underweight, undernutrition, low birth weight, and anemia. So this is one kind of question they can ask you which diseases are covered. And then they can ask you how much we are making a target. We want to reduce their prevalence every year by 2%, 2%, 2%, 3%. If you look very carefully, this became a separate program, Anemia Mukt Bharat. Reduction of prevalence of anemia by 3 percentage points every year. Can you tell me level of salt iodization? How much is at production level? How much is at consumer level? How much we maintain in India? Production and consumer level. Yes, 30 parts per million at production level, 15 parts per million at consumer level. The program is known as National Iodine Deficiency Disorders Control Program. What is the major impact indicator of this program? There are many indicators in this program used for impact. Which of them is best? Is it urinary iodine excretion? Is it neonatal hypothyroidism? Is it prevalence of goiter? Or is it TSH levels we measure? It is urinary iodine excretion, which we measure in pregnant females over a 24-hour period. Sorry, pregnant females, 24-hour period. This is right. Okay. So friends, where many students say how to stay motivated. Best way to stay motivated is remind yourself that how far you have come till today. Look at last few months. Many students have been asking or studying since last few years also in MBBS. You have studied a lot. So keep that in mind. You have been working so hard. So just few days are left. You have to continuously do. Yes, this is a small city in Italy, Maiori. So think about what you have achieved till now. I think that is the biggest motivation you will get in life. Because डॉक्टर बनना भी आसान नहीं है. If you have become, then definitely you must have it in you कि यहाँ तक पहुँचो. If you have reached till here, then no doubt you can take it further also. It's in your hands only, right? Healthcare system of India. Primary healthcare is characterized by 4 A's. What are these 4 A's? Anyone remembers all 4 without looking at notes? Anyone remembers? Yes, Udaipur is also almost same looking. Yes, very right. Dr. Noon is saying it is should be acceptable. It should be accessible, available, and affordable. Friends, when we are reading them, they appear very easy. But just remember, when examiner is going to make a question, he will ask all of the following are included in primary healthcare definition, and all 4 choices are going to be from A only. So you have to give multiple readings. A student asked, sir, what is the mnemonic? I told him this is the mnemonic. 4 A's: acceptable, accessible, available, affordable. This definition was given at Alma-Ata Conference 1978. Then beside definition, they ask you elements and principles. 8 elements. Mnemonic is elements. So first is essential drugs. Can you tell me which is the most essential drug at a primary health center and how many essential drugs are there at a PHC? Most essential is paracetamol and total number of essential drugs are 33 to 38. Very right, Dr. Himanshu. L is locally endemic disease prevention and control. Whichever disease is present in that area, its treatment must be available. This is education, health education. M is maternal and child health. Please remember it's not directly written. This will include family planning. So family planning contraception is an element of primary health care. Then next is EPI, Expanded Program on Immunization, now known in the country as Universal Immunization Program, 1985 onwards. N is nutrition. So can I say free food supplementation when I write nutrition? Can I say free food supplementation? No, it is only nutrition related health advice. T is treatment of common ailments, diarrhea, pneumonia. Its treatment must be present at a PHC. S is safe water supply and sanitation. Multiple reading is the key. This topic is asked in INI-CT exam also. They'll give you multiple components. Which of them are included in elements of primary healthcare? So there are a total of 8 elements of primary health. So 4 A's, 8 elements, and we have 4 principles or pillars also. What are these 4 principles or pillars? Equitable distribution. All should get same services. Appropriate technology. Appropriate technology means it should be cheap. Results like expensive technology. What are the good examples of appropriate technology? ORS, exclusive breastfeeding that we discussed yesterday, kangaroo mother care, neonatal hypothermia prevention, and standpipe. Tap in the center of the village on a raised platform. People can come and take water. Even Shakir's tape is a good example. Very right. Then best example of community participation in India. Asha. Asha is selected from the same village where she is supposed to work. From China, we have Chinese barefoot doctors. Chinese barefoot doctors were not doctors, they were actually rice farmers. And intersectoral coordination. So, how to remember this, friends? One of them will definitely come. So, 4 A's in the definition, 8 elements, 4 principles or pillars. 4 principles or pillars. Chinese barefoot doctors actually, doctors don't want to go to work in rural area. So rice farmers were given basic training on management of fever, diarrhea. Like we in our country also it is there. So this is community participation. Healthcare, 3 levels are there. This table becomes important. Let's do in detail. What is primary level? It is defined as first contact level. Secondary level, first referral level, tertiary level, second referral level. Now, which health centers deliver primary level of healthcare in our country? Please do not say sub-center, it may be wrong. Better answer is both sub-center and PHC together. Primary health center also. deliver primary level of healthcare. Secondary level is delivered through CHC, Community Health Center, and tertiary level is through medical colleges and hospitals. Now, when we look at their population norms, this is asked most frequently. Population norm for a subcenter in plains is 1 per 5,000. You can revise side by side. Hilly areas 3,000. And see how many of you were correct. That will also come almost, doctor, at the level of CHC, district hospital, sub-district hospital. PHC 30,000 and 20,000. CHC 1,20,000 and 80,000. Medical colleges do not have any such defined norm. Underlines are the questions of your paper, so you can see population norm is a favorite topic of examiners. Numbers, when we look, we have been asked only for PHC. Bed, how many patients can be admitted for these? Staff, we have been asked for this. So when we look at total number of primary health centers in the country, it is more than 25,000. Now it has reached up to 30,000 also, but it has not yet appeared in our textbook. Sub-center 1,55,000, 5,500 CHC, 700 plus medical colleges in the country. Beds. There is a provision for admission of 4 to 6 patients at a PHC, 30 patients at CHC. Medical college, it's not fixed. Bigger the medical college, we have 500 bedded, 100 bedded, 1000 bedded also, 1500 bedded also. Then what about sub-center? Can you admit patients at a sub-center? Can you admit patients at a sub-center in our country, friends? Yes. So 0 to 2. Staff, when we look, 3 to 4 is at sub-center. 13 to 21 at PHC. And 46 to 52 at CHC. Medical college, bigger the medical college, more number of staff will be there, right? Many are there. Safdarjung is such a big hospital, even it is having 1,500. Then, see, this is one type of question. You will be asked from primary healthcare definition, elements, principle. Second is the health centers. Then can you tell me sub-center A and B, what is the difference? This was the question. Yes. No delivery facility at type A. Delivery facility is present at type B. Who is the key health functionary of sub-center? Who is the key health functionary of sub-center? Yes, it is multi-purpose worker. Also, one more question. Sub-center is the most peripheral unit for delivery of healthcare. So it is not PHC. It is sub-center, which is most peripheral. And also, eligible couple register is maintained at sub-center. So many questions have been asked from different topics. You have to collate at one place. PHC also is type A, type B. What is the difference in type A, type B? Yes, up to 20 deliveries a month. More than 20 deliveries a month. What is the lowest level where a MBBS doctor is available? Lowest level where a MBBS doctor is available is PHC. CHC has MD, MS specialist as the major working force. Specialists are there. So definitely one question will come from this table. This should be on our tips. Then we come to grassroots level workers 5. So third question generally comes, one from primary healthcare definition element principle, one from health center, one from health worker. So 2 to 3 questions come from this particular topic. Now, when you look at 5 major grassroots level workers, ASHA has a full form. What is that? Accredited Social Health Activist. MPW is multi-purpose worker. VHG Village Health Guide, TBA Traditional Birth Attendant, what we called as trained dai. So traditional birth attendant. AWW is Anganwadi worker. Now let's quickly mark which questions are asked in the paper. So you can see underlines are the different questions of national board. From this topic, usually INICT will not ask a question. Okay, these are the questions which have been asked. Let's quickly go through them. Asha, VHG's Village Health Guide. Its older name was CHW, Community Health Worker, now known as Village Health Guide. Asha is located not at any health center, but she is posted at village level. Multi-purpose worker, we have just discussed sub-center. Such a easy question came in your paper. Health guides are located at village level. Traditional birth attendant village. Anganwadi worker, Anganwadi center, ICDS we discussed yesterday. Population norm of Asha currently is 2 per 1000. Earlier it was 1 per 1000. So if correct answer 2 per 1000 is not available in the choice, then you mark older answer 1 per 1000, but that is wrong now. Multi-purpose worker sub-center is 5000. Village we take as 1000. Anganwadi worker we discussed, one center is for 400 to 800 population. Education level of Asha should be minimum 10th pass. Village at height 6th pass. These two questions have been asked separately. MPW 12th pass. TBA don't require any such. Anganwadi worker is 10th pass. Training duration of Asha also has been asked is 23 days. 12 months for MPW, 3 months for Village Health Guide, 1 month for Traditional Birth Attendant, 4 months for Anganwadi worker. So friends, these two tables you have to know. There is no shortcut, revise them in the last few days of the exam so that we don't miss out on such a easy value-based question. Asha is a component of National Rural Health Mission. 25 to 45-year-old female, a resident of same village. Other parameters of Asha we have already discussed, right? CHC will not be what we have discussed, that is sufficient. Therefore, I have not kept a separate slide. Selected by village panchayat. Can I say Gram Sabha? In one of the question, one of the choices was Asha is selected by Gram Sabha. Is this correct? Answer is yes. So village panchayat, same as Gram Sabha. She is accountable to village panchayat. Training is done by INICT question, Anganwadi worker and auxiliary nurse midwife. Asha is a bridge between village population on one hand, auxiliary nurse midwife who is also posted at subcenter on the other. Asha has 4 major impact indicator, which is the biggest indicator we discussed yesterday. Infant mortality rate, very right. Otherwise, TB cases detected per year, leprosy cases detected per year, protein energy malnutrition rates. So 4 indicators of impact are there. Best is IMR, reduction of IMR, to assess the work of Asha. More details will not be asked. Don't worry about these workers. They will not go into more details. ANM you can consider is equivalent to multi-purpose worker female. If multi-purpose worker female post is vacant, then also we bring in ANM from outside. Auxiliary nurse midwife. ANM is auxiliary nurse midwife. Environment. This is a topic which is purely value based. Which instrument is shown here? What is the use of that instrument? Good. This is chloroscope. It's written also on the image. And it is used to measure free or residual level of chlorine in drinking water. Can you tell me, in drinking water, what is the recommended residual level of chlorine? Minimum recommended. 3 levels have been asked in our paper. It should be minimum 0.5 milligram per liter, which is same as ppm, for a contact period always of 1 hour. See, what is the meaning of this? When you add chlorine to water, it destroys all the impurities, and itself also it is consumed. When water becomes clear now, we add some additional chlorine that remains in water for next 24 to 48 hours. That is known as free or residual chlorine. So that should be minimum 0.5 milligram per liter. In swimming pool, it should be minimum 1. To kill cyclops, minimum 2. For all, contact period is 1 hour. Chloroscope. Look carefully in the exam. Don't mark it as Sahali's hemoglobinometer. These are chloroscope. Residual chlorine level in the water. Which is this instrument and what is the use of this instrument? Yes, Horrocks apparatus. What is the use of Horrocks apparatus in public health, friends? Good. Dr. Harry Potter is also here. Residual chlorine level is not, it is chlorine demand. What is chlorine demand, anyone? Harry Potter is without Hermione, right? So we don't have a Hermione in the class today. So chlorine demand, Horrocks apparatus. What is the formula, anyone remembers? Because formula is the key to solving the question given below. What is the formula? Good. Many Dr. Yashi is right. N into 2 grams of bleaching powder can disinfect 455 liters of water. If you can remember this formula, you can solve the question. What is N here? Anyone, what is N here? What is N here? Yes, formula, you are right, Dr. Asta, Dr. Himanshu. Yes, number of first cup to show color change. Actually, this is having 6 white cups and 1 black cup. So this is Horrocks apparatus. So what we do, in these levels are there, you fill up water up to number 1 to 6 in increasing levels. Indicator solution is starch iodide. From that, after mixing with water, put 2 drops in each of the 6 cups. Any cup may show color change. Whichever cup show color change, rest of the cups will also show color change. So if third is the first cup to show color change, third, fourth, fifth, and sixth will also show color change. So N will become number of first cup to show color change. That is 3. Now read this question and mark the answer. This is how exactly question came in your paper. Yes, let us write in front of us. For 455 liters, we require N into 2 grams of bleaching powder, where N is the number of first cup to show color change. What is N in this question? In the question which is given? Third cup. So this is your N. So 6 grams of bleaching powder can disinfect 455 liters of water. This is how we calculate. But in this question, they're asking 20 to 50, 2250 liters of water will require how much bleaching powder? So 20 to 50 liters will require 30 grams of bleaching powder. So remember the formula. Remember the formula. Starch iodide is the indicator. Remember that it is for chlorine demand estimation. Chlorine demand estimation. Hardness of water means soap destroying power. Temporary hardness occurs due to, this was the question of your exam. Temporary hardness occurs due to calcium and magnesium salts of, very right, bicarbonates. And permanent hardness occurs due to sulfates, chlorides, nitrates, three of them. Again, calcium and magnesium sulfate. When is softening recommended? No need to remember the whole classification, but two questions from this cutoff level. Softening is recommended if level of hardness is more than 150 milligram per liter, which is 3 milli equivalents per liter. Both questions have been asked separately in our paper. Right? So once they ask choices in milligram per liter, 150, once in milli equivalents per liter, 3. Problem village. If water source is located at a distance more than, what is the answer, friends? All value based questions. 1.6 kilometers. Depth more than 15 meter. You have to drill the ground 15 meters to bring out the water. Elevation. In hilly areas, people may have to climb and bring back water back to their home more than 100 meter. Or water contains excess of one of these four: iron, salt, arsenic, or fluoride. Any one of these. That will also make it problem village. So any of these four criteria present is defined as a problem village or problem habitation in the country. So they ask all of the following are criteria for a problem village except these type of questions come. Which three bacteria are used to assess water quality in the country? Question comes all except. So which three bacteria are used to assess water quality in the country? Yes, one is coliform, and in coliform, best is E. coli. Also, we use fecal strep and Clostridium perfringens, also known as Welshi. Now, we have discussed which of them, which of them is the best indicator overall of water quality. If you look at all three coliforms, fecal streptococci, Clostridium perfringens, or Welshi, very right. It is E. coli which is best overall. Which is best indicator of recent contamination? Fecal streptococci. And which is the best indicator of remote contamination? That is Clostridium perfringens. E. coli, they ask you two separate questions also. What is the screening test used in India? What is the diagnostic test used in India? Screening test used in India is presumptive coliform test. It is through MPN, multiple tube method. You will read in microbiology. Most probable number, multiple tube method. Diagnosis is confirmed by Eichmann test. So bacterial quality or bacteriological quality of drinking water. Very right. Water sample collection appeared in our exam for the first time. So we have to use tap which is already in use to collect the water sample. Heat the tap till it becomes hot to touch, sterilize it. Then allow water to run waste for how long? Because it is here where students made a mistake in the paper. Allow water to run waste for 2 minutes. And then collect gentle stream without splashing. Right? Any sterile bottle we can use. Earlier we used to use Winchester quart. for collecting water sample in the country. Water sample in the country, right? Or logically, if tap is made of plastic, do not heat the tap, right? So these are guidelines based on the older types of taps in the country. Air, two instruments separately asked in our paper. So which are these and what is their use in public health? That was the question. So what is on the left side is sling psychrometer. What is its use? Which quality of air it is used to assess? Air humidity. What is on the right side is red bulb at the end. This is a type of Carta thermometer used to assess which quality of air? Yes, low air velocity. Earlier it was used for cooling power of air, but now it is used to assess low air velocity, right? What is this? Can you tell me what is this, friends? This is India's National Air Quality Index given by Central Pollution Control Board. Air quality monitoring is the responsibility of Central Pollution Control. So it is given a classification where air quality index is divided into categories. You have to remember this classification because how question came in the paper. They gave on this date, this is the NECI, this date, this date, this, and they will ask you on any particular date. It will be categorized at which level of this categorization. So when you look, this is known as light green. Sorry, dark green is good. If it becomes light green, it becomes satisfactory air quality. Then it becomes moderate yellow, poor orange, very poor red, and severe dark red. Majority of cities of India, they struggle between 100 to 200 to 300. So if you look at even big cities of India right now, if you check Delhi, Mumbai, Hyderabad, Bangalore, Cochin, you will find everywhere it is 100, 200, 300. Above 500, many cities of India goes in winters. Delhi goes 999 also, right? So this is a classification you will have to remember. You will have to remember. So when I was traveling to Switzerland, Italy recently, I was checking air quality everywhere. So I was finding wrong numbers like 5, 10, and 15. So my lungs were not able to accept. So when I came back to Delhi, they felt normal. Right? So this is what will happen if you choose to be born in a country like India. Right? So you have chosen it yourself, like you chose your MBBS yourself. You cannot change it. We cannot. Yes, in many European countries, if air quality index goes close to 60, 70, they shut down the city. They shut down the city, all the work is closed. And in our country, when it becomes 300, then we start working, right? Okay. Now, National Air Quality Index is made of multiple components. What are the multiple components? What are these? These are particulate matter 2.5, particulate matter 10, sulfur dioxide, nitrogen dioxide, carbon monoxide, lead, ozone, ammonia. You have to remember these 8 components. They have never been asked, but high chances they may ask in INICT. National Air Quality Index is based on 8 components. Which is the best indicator of air pollution? Single best answer. What should I write? If you are allowed to measure one thing in air, that is sulfur dioxide. Now, importance of practicing PYQs. Once they are same question, which is the best indicator of air quality, and each choice was a combination of three indicators. So single answer SO2, but 3 combination of indicators. sulfur dioxide, suspended particulate matter, and smoke. So we can say 3S. So air quality monitoring is the responsibility of Central Pollution Control Board. Can you tell me Central Pollution Control Board means which ministry in the country? Can you tell me Central Pollution Control Board means which ministry in the country? Yes, Ministry of Environment, Forest and Climate Change. Which other component of PSM important one it covers? Ministry of Environment also covers which other important component of PSM? That we have already discussed also. Yes, Dr. Vaishu is right. Biomedical waste management also, Dr. Shweta, you are right. Biomedical waste management also under this ministry. Sound. Tolerable, these are value-based questions. Tolerable sound level to human ear is 85 to 90 decibel. Above this, auditory fatigue starts. Above 100, permanent hearing loss. Above 150 decibels, direct tympanic membrane may rupture. So value-based questions have been asked, which you study in ENT also. Which should be quietest sound-wise? Class, library, auditorium, hospital ward, or OPD? We expect in India, most quiet should be hospital, whereas it is exactly opposite in the country. So they asked, what is the acceptable sound level in a hospital ward of India? It is 20 to 35 decibel. In fact, library also they tolerate a slightly higher level, right? So 20 to 35 decibel tolerable sound level in the country. लाइब्रेरी क्यों नहीं, ये तो वो बताएगा जिसने गाइडलाइन बनाई, राइट? So guideline wise, hospital what should be quietest? You have seen Indian hospitals, therefore this question came to your mind. Actually, hospitals are quietest. When you look at any hospital in developed countries, they are actually quietest, right? यहाँ तो पार्टी हो रही होती है वार्ड के अंदर. So this is sound. Housing. Overcrowding criteria are asked along with the cutoff. So 3 overcrowding criteria. Persons per room if more than 2. Floor space per person if less than 70 to 90 square feet. And sex separation above 9 years if it is absent. So respiratory diseases, TB, measles, COVID, or skin diseases like scabies can occur. Greatest source of radiation outside the house is sunlight, cosmic rays, extraterrestrial radiation. Inside the house, TV, man-made X-ray. Greatest source of radiation. Simple one-word answer-based questions. State receiving maximum solar radiation in the country is Rajasthan. I told you, whenever any illogical question comes in NEET PG, for which students are not able to decide the subject, then student decide it must be from PSM. So this geography question came, state which receives maximum solar radiation, it is from Rajasthan. What I will do is, in tomorrow's END, I will put one more such strange question which appeared in INI-CT exam. You will be surprised to look at the question and let us see how many of us will be able to solve this question, right? Then what is the permissible radiation exposure? You have read in radiology, 5 rad per person per year. Pregnancy, 0.5 rad per pregnancy. Value-based question. Lead apron. What is the expected thickness of lead apron? It should be, yes, less. It should be minimum 0.5 millimeter. Which level of prevention this is? Primary level specific protection, because risk is present, right? Which of them transmits polio virus? This was the question. It is sewage. So this is solid waste from street or industry, solid waste from kitchen. This is liquid waste containing excreta, human fecal matter. So it can transmit, sorry, all fecal viruses and bacteria. Sewage is liquid waste without excreta. Sewage contains how much water? Older NEET PG question. Yes, almost total 99.9%. This is to emphasize only 1.1%. Only 0.1% is fecal matter solid, but that is sufficient to transmit. That is sufficient to transmit hundreds of viruses and bacteria. Can you tell me what is the best method of solid waste disposal in India? Older question. NEET PG again. Burial, no. Refuse is solid waste from street, industry, or house. Garbage is solid waste from kitchen, processed food item. Very right. Best method is sanitary landfill. Anyone, what is the other name of sanitary landfill? What is the other name of sanitary landfill? Controlled tipping. Yes, 1 acre for 10,000 population, 1 acre is required for 1 year. How do you measure strength of sewage? Yes, biological oxygen demand, chemical oxygen demand, and suspended solids. In strong sewage, how much is BOD? This was the question. 300 milligram per liter. So strong sewage BOD is 300 is the cutoff we have to remember. Underlines are the questions of our paper. Right? Then we look at last component of environment, medical entomology. Sand fly we have discussed. Biological name Phlebotomus. What does it transmit? I will write abbreviations which we have already covered. So it Kala-azar, oriental sore, sandfly fever, and Oraya fever. So in India, we transmit. No, sewage strength we don't check. We check how much oxygen they consume. That is Dr. Jayant, biological oxygen demand. CC fly, playbot, is Glossina. Which disease it transmits CC fly, anyone? Yes, sleeping sickness of Africa. African trypanosomiasis. Ridovid bug, sleeping sickness of America, commonly known as Chagas disease. Ridovid bug, Triatomine, is popularly known as kissing or assassin bug. As I tell students to remember, Imran Hashmi of Vectors, kissing assassin bug is Ridovid bug. But recently, this infectious disease reached Udit Narayan also. Right? So, Ridovid bug is Chagas disease, we have to remember. Rat flea transmits three major diseases on this planet. What are those? Rat flea, very right, Xenopsilla chiopsis. Partially blocked is most dangerous. Is most dangerous. So it transmits plague. It transmits one rickettsial disease also, endemic typhus, and it transmits shigellosis. So whenever a vector is transmitting 3-4 disease, question comes all except. Please remember, sorry, we are discussing only those vectors which have been asked multiple times in your exam. Soft tick can transmit only 3 diseases. What are those? KFD. But KFD in India is by Hartik. So it is outside India. Q fever. But actually Q fever has no vector. Here we are talking of animals. So how does Q fever transmit in humans? How does Q fever transmit in humans? Very popular question. It is by respiratory route. It can also transmit by milk, but major route is aerosol or inhalation. And it can also transmit, what is the third disease by soft tick, friends? Tick typhus, no, that is also through hard tick. Relapsing fever, Borrelia. All other tick-borne diseases are through hard tick. Tularemia, babesiosis, Indian tick typhus, tick paralysis, tick hemorrhagic fever, Congo fever, tick encephalitis, all other are through hard tick. Louse can transmit only few diseases. So this also comes all except. So all other tick-borne are hard tick. Louse transmits to rickettsial disease, epidemic typhus, trench fever, then relapsing fever, two types. One is through soft tick, one is through louse, and pediculosis. Which eye disease does not occur in India? Ocular disease, which does not occur in India, is onchocerciasis. Yours used to occur in India. Onchocerciasis, river blindness, black fly simulum vector is not present in India. Identify. This image comes every alternate year in your paper. Anopheles. How do we identify? Sits at 45 degree. And also characteristically it has black spots on margins of wings. So black spots on margins of wings, spotted wings. It transmits mainly malaria. QLC faces in rural, Stephen's in urban, you have already told me. This is Aedes, commonly known as tiger mosquito. Important diseases it can transmit. It sits parallel with a small hunch or the bend around the neck. You can see here parallel with a small hunch or the bend around the neck. Yes, important diseases it can transmit: dengue, chikungunya, yellow fever, and Zika. Also Rift Valley fever. This is sophisticated mosquito because it requires clean water for breeding. Aedes require which type of water for breeding? Artificial collections of rainwater. Broken tubes, tires, bottles kept on the rooftop of houses, desert trays, AC trays, right? Desert cooler trays. If it is not Anopheles, it is not Aedes. Then we look at Culex. Culex also sit parallel with a small hunch around the neck. How do you differentiate from Aedes? Aedes has white stripes on body and legs. Culex we don't have. Culex tritinio for JE. Culex quincunfasciatus for filariasis. What is the vector of West Nile fever? Culex pipiens. So 3 Culex species are also asked in our paper, right? Diagnose this. First one has been asked in our paper. Anopheles larva. Anopheles larva rest parallel to water surface because there is no siphon tube, which is like our nose. But when you look at Culex Aedes larvae, They rest at an angle to water surface because they have got siphon tube to attach to water surface and take the oxygen. Three images in three different papers, but all three are same, sand fly. Other questions we have discussed, so we will skip. Identify. First is rat flea. We have discussed the three diseases they transmit. Second is louse. We have discussed the four diseases they transmit. Mosquito control. Source reduction. Which level of prevention? We discussed yesterday. Primordial. Mosquito nets. Which level of prevention? Primary. Chemical include DDT, pyrethrum, malathion. Many are there, but four are asked in PSM. And Paris green. Which level of prevention these four represent? Which level of prevention these four represent? Again, primary. First three are different from fourth. First three are anti-adult. How do they kill adult mosquito? They act as contact or nerve poison. At biomolecular level, they asked, how do they act as contact or nerve poison? They inhibit a particular enzyme. What is that, friends? Good. ACHase. Acetylcholinesterase inhibition. All these questions have been asked in the paper. Whatever I am writing on the screen. Paris green is anti-larval. How does it kill the larvae? It is a stomach poison. Copper acetoarsenite. Copper acetoarsenite. Biological control is through more common than guppy fish is Gambusia. Which has highest affinity anti-larval. It eats up the larva, larvivorous fish. Highest affinity for Anopheles larvae. 8 to 34 days is the lifespan of a mosquito in India. 8 to 34. Anti-larval choice in urban areas, we prefer abate. For adult, we prefer pyrethrum. For adult, we prefer pyrethrum. Otherwise, what is the best measure of mosquito control in urban areas? Anyone? What is the best method of mosquito control in urban areas generally? Source reduction is not possible in our country, frankly. So what do we suggest? Urban areas. Urban areas, it is regular cleaning of water tanks. Regular cleaning of water tanks, anti-larval. Regular cleaning of water tanks, we are targeting Anopheles, right? Larvae, abate for larvae. Abate is for larvae. Pyrethrum is for adult mosquito. Social sciences. We come to a topic which is purely based on definitions. Purely based on definitions. So quickly, let's go through these keywords. Culture. Keep on revising side by side, even if you are not able to write in the chat box. Learned behavior, which is socially acquired. Examiner cannot change these words. What is acculturation? What is acculturation? Mixing of two cultures. So definitions are asked from this chapter. Also known as cultural contact. What is internalization? Imbibing others' values and make them your own. So if you like honesty, truthfulness, hard work, trustworthiness in someone and include in your personality, this is known as internalization. Acculturation is related to culture. Internalization is one's own choice. One's own choice, what you want to learn from others. What you want to learn from others. Social structure definition was asked. It is pattern of relationships in a society. Interrelationships in a society. Social pathology. Role of social factors in a disease.
Yeah.
See, these are pure definitions. Read it once, you will not falter in the paper. Okay, now we come to the interesting recent most question. Difference between crowd, mob, herd, and band. This you have to now remember. So all of them are group of people, but how they are different? Group of people who come together temporary for a short period. They have no leader, no organization. Cricket match, that is a crowd. You go to watch a cricket match temporary for some time. There is no leader, no organization. Mob. Mob is also a people coming together. Let us replicate this definition for a short period. But what is difference is mob has a leader and it is more emotional. Examiner will mention these words in the question so that you identify them correctly. So leader may guide the mob. It is again unstable, no organization. Herd. Herd is a crowd with leader who follows questions of the or who follows instructions of leader without any questioning. So whatever the leader they say, they will follow. But mob is more emotional, please remember. Band is families living together in a community. Now, what was asked in your recent paper was a tourist guide is having a group of 20 tourists with him or her. This is an example of crowd, mob, herd, or band. So, tourist guide, when he's leading a group of tourists, that is a herd. It is not a mob, right? Mob is very emotional. It can do anything anytime. So, tourist guide will never say, let's burn this down. So, tourist guide is leading a herd, right? Politicians fit into all. When they organize a rally, people are not even aware which party has organized the rally, who is coming to speak. Politicians can instigate mobs. We have seen they can do anything. And people follow them without questioning whatever they are saying. So politics fall into everything, right? Okay. Disease occurred due to putting profit ahead of health. This was the exact question of INICT. Which theory of disease causation in sociology this is? This is Marxist theory. So others have not been asked. Parsonian theory is due to social constraints. Feminist theory says disease occurred due to females. Foucauldian theory says disease occurs so that population can be divided into groups. Right? Macnion theory of tuberculosis says reduction of TB whenever it occurs in a country is only due to socio-environmental changes. There is no role of doctor. There is no role of DOTS or medications. That is Macnion theory of tuberculosis. Feminist theory says disease occur due to female. So this must have been given by some frustrated one-sided lover male. So it said that disease occurs due to females only. Right? Okay. So these two you have to know, Marxist theory and Macnion theory of tuberculosis. Opinion, belief. Another INICT topic. Opinion are temporary provisional views. Temporary provisional means they can change with time. How is your NEET PG paper going to come? Easy, moderate, difficult. It will change with time. Whatever answer you give today, easy, moderate, difficult. Will it take place on the designated date? It may change. Will there be negative marking increased from 25% to 50% this time? It can change. So opinions can change a lot. Opinions are subjective in nature. Beliefs are also subjective. Beliefs are more stable, permanent views. So different religion, different caste, different families, different beliefs are there, right? Attitude is more objective in nature. What is attitude? It is more or less permanent ways of behavior. So please remember, opinion and belief is in mind, but attitude is a type of behavior. What is your attitude towards National Board of Examination? What is your attitude towards politician? What is attitude of public towards doctors in the country? This is permanent ways of behavior, right? Okay. Nuclear family. One married couple with or without kids. Joint family. More than one married couples with or without kids, where males are related by blood. They have a common kitchen usually, common pool of income, functions are divided, work is divided, and they have a commonly held property also. Three generation family, three successive generation. Where will Amitabh Bachchan family fit into this? To help you understand, Amitabh Bachchan family is three generation family. Can I say Amitabh Bachchan family is a joint family? Yes, by definition, yes. Therefore, three generation is a subtype of joint family. Subtype of joint family. Saif Ali Khan family will be a nuclear family, right? यजुवेंद्र चहल तो इस चीज से आजाद हो चुका है, राइट? So otherwise, nuclear family, joint family, three generation family is the traditional family system of our country. New family, where marriage duration is new. New means less than 10 years. So we are only looking at definitions which have been asked in the paper. So 2 months ago, Yajwinder Chahal was in new family. He migrated out of new family. Communal family. Each member has a defined role in management. This is like division of labor. Adults will earn, children will study. This is a communal family. So every family is communal in India. Even when you clear PG exam and you go to your department will be a communal family. Right? So you will do work 24/7 in the department. When you get off, you will do the work of the house of the head of the department. So this is communal family. Broken family. Both parents not together. Death, divorce of so death, divorce, or legal separation. Both parents are not together. So cricket and Bollywood is full of them. So we have Amir Khan, broken, again became new, broken, again became new. Then we have Saif Ali Khan, broken, again became new. Shah Rukh Khan is nuclear. Hrithik Roshan is broken. Earlier it was new, right? Salman Khan is nowhere. Problem family. Sanjay Dutt family, Shilpa Shetty, Raj Kundra family. Families which lag in progress behind rest of the society. So you have to remember to pick up the keyword in each definition. Right? So family lags in progress behind rest of the society. Family cycle is from which point to which point. 6 stages are there. You have to memorize. We'll go very fast because this is easy to remember. It is in sequence. Marriage till first childbirth. Extension. First childbirth. It came in your last paper also. Last childbirth. Third stage, complete extension. Last childbirth, you can revise side by side how much of you this you remember. First child leaves home. Contraction. First child leaves home till last child leaves home. Last child leaves home till death of spouse. Death of spouse till death of survivor. Last stage is also known as extinction, dissolution. So how question came in the paper? They'll give you a clinical, they will give a scenario. This is the stage. Couple, children, whether they are at home, all present or not, someone has left the home, and you will be asked to classify. Like the easy question was, a married couple delivers their first child. Which stage of life cycle family they belong to? A couple delivers their first child, nuclear family. They are now in, no, this is the mistake we have to prevent. Answer is not formation, but extension. Marriage till first childbirth is formation. What was the question asked in the paper? A nuclear family, a couple delivers their first child. The moment first child is delivered, now the family is in extension stage. What is this depicted by this diagram? Yes, this is modified Kuppuswamy scale. It is used for rural areas, urban areas. Socioeconomic status of urban families. What do we use in rural areas then? Which scale do we use in rural areas? Uday Parikh and BG Prasad. Uday Parikh is not based, Uday Parikh is not based on income, right? Okay. Radhukar Shetpurkar also we can use absolutely. Modified Kuppuswamy scale is based on three components. Also, they ask the score of upper class 26 to 29. What are the three components of modified Kuppuswamy scale, friends? Yes, education, but this is only for head of family. Occupation, again head of the family, and income. So, components and score of upper class is asked 26 to 29. So, education, occupation is only taken for head of the family. Income is for the whole family or per capita. So these smaller chapters we are going fast because we have to cover everything. Disaster management. First is definition based question. When do we call it a disaster, friends? What is it? Technical cutoff. Very right. 30 or more persons simultaneously require hospital emergency services. Thirty or more persons require simultaneously hospital emergency services. Mitigation. What is that? Definition was asked in your paper. Prevention of conversion of hazard or risk into disaster. See, as such, we cannot prevent disaster from coming. So its practical meaning is what you can do to minimize damage. So recently there was a big earthquake in Myanmar. Some parts of Thailand also were affected. So actually a question came based on this. What will be your suggestion for disaster mitigation in Myanmar? You cannot prevent a risk from converting to disaster, but what you can do to minimize damage is building designs. Building should be low floors, more wooden material used, and if it is high floor, so earthquake resistant type of structure should be made. Surge capacity, ability of a health system to respond to disaster situations. Right? Now, this you have to remember. First is disaster cycle steps. A disaster strikes, response, rehabilitation, reconstruction, mitigation, preparedness. See, this is not difficult. If you read logically, impact occurs, response will be medical response. Then rehabilitation. We try to focus on houses are broken, schools are broken, hospitals are broken. Then we start the reconstruction. And finally, mitigation for next disaster and preparedness before actually it comes. Latest question was this. Recovery phase of a disaster includes 3R. Response, rehabilitation, and reconstruction. The other was not asked last time. Most likely they will ask this time. Risk reduction phase includes mitigation and preparedness. So there are two phases, recovery phase, a risk reduction phase. We are talking of NEET PG exam latest question, right? Yes, this is from PARC only. What is this, friends? Sorry. This is TRIAGE. Categorization of victims of disaster based on, in a single shot, mark the correct answer. It is based on, yes, not on severity, but on likelihood of survival. So it is not based on severity, but on chances of survival. 4 categories. Red has highest priority. Which patients are included in red? Those who require resuscitation or limb oblique life-saving surgery in 0 to 6 hours. Yellow, high priority. Possible resuscitation or limb oblique life-saving surgery in 6 to 24 hours. Green, low priority. Minor injuries, non-life threatening. So which group of patients will be included here, friends? Very right. Dr. Asta, you are also right. Ambulatory patients. So patients who can walk about, we presume they are having minor injuries. And finally, who is least priority black? What does it include? Dead and moribund patients. So most serious person, moribund, about to die is last priority. So we are not trying to save the serious person. We are trying to save maximum life. So triage is based on likelihood of survival. Triage should be done at site after reaching hospital or during transportation. At site. Most common disease after disaster, most common vitamin deficiency. What is the answer? Yes, disease is acute gastroenteritis and vitamin A deficiency is more common than niacin and C deficiency. So one word answers. Therefore, we are going slightly faster here. What is the status of vaccination in post-disaster phase? All vaccines are contraindicated. We have discussed because they take time, except measles, which can form faster protection. All vaccines are contraindicated, especially typhoid, cholera, tetanus. But what is the paradoxical policy of WHO? These three, which are contraindicated for population, these three are mandatory for doctors and nurses. So I'll repeat. All vaccines are contraindicated, typhoid, cholera, tetanus especially, but these three are mandatory for doctors and nurses. So if you cannot vaccinate the population, how will you prevent disease spreading? Most important preliminary step. Now, hepatitis B has nothing to do with disaster situation. Is chlorination of water bodies. Residual level of chlorine in drinking water is 0.5. But here we try to maintain how much level? Minimum 0.7. Preferably 1, but minimum should be 0.7 post-disaster phase. Which ministry is nodal ministry for disaster management in India? उनको खुद भी नहीं पता है, but which is the ministry that we should know for exam? That is Home Affairs. And where do we create nodal center? All these are exam questions only, friends. Nodal center is a district level, very right. Maximum mortality is in geological, hydrological, nuclear or chemical disasters. Which disasters have maximum deaths? Geological, hydrological, nuclear, chemical? It is hydrological. Floods every year in India and world take maximum lives. Earthquakes are not so dangerous. Floods are. So hydrological disasters. When do we have World Disaster Reduction Day? 13th of October. For you, it will be on 30th of June. Why 30th of June? Your NEET PG result will be out on 30th of June. Right? Okay. Worst man-made disaster in the world is Bhopal gas tragedy. India. Right? So it is very easy to feel motivated when everything is going well. But trust me, now the things will get tough over next 45-50 days. It is at this time you have to keep yourself motivated, and that will be the most difficult thing, because you will see students around you who will give you FOMO. Don't listen to those students. Only trust on yourself. Only trust on yourself. right? So next, this is a small village in Switzerland. This time I went into interiors of Switzerland, Pringi, a small village in one of the districts. So stay disciplined. Next 2.5 months, you are not allowed to break the discipline, friends. If you have made a rule, okay, I will study 8 hours a day, don't make it 12 hours, but at least 8 hours a day you have to study. If you have made a rule, I will practice 100 questions a day, no need of going to 150 questions, but at least practice 100. But the moment you break the cycle, okay, let me not practice questions for next 2 days. This is going to harm you. That is going to harm you. So stay disciplined. Result will come in your favor. Demography, another chapter fully based on definitions and values. Yes. So let us go through it. Demography, we know, scientific study of population. Demographic processes are five. What are these? Fertility related to childbirth, marriage, mortality. Please remember morbidity is not included. Morbidity is not. Migration, which is physical, geographical, one place to another. And social mobility. What is social mobility? How it is different from migration? Very right. It is movement of a person across socio-economic status. Movement of a person across socio-economic status. How many of you have heard about Dream 11? Everyone must have heard, right? So what Indian cricketers, movie stars are doing, they are shamelessly promoting this gambling app. All children, youth and adults of India are addicted to this app. Right? So it is leading to social mobility in the lower socio and middle socio-economic state of the country. Right? No one is going to win anything. But the person who came up with this idea of social mobility of Dream 11, he has become super rich. He has become super rich. So if you want to do social mobility, come up with the idea. Don't play Dream 11. Right? If you work hard for next 2.5 months, it will make a difference between college in Delhi to college in Andaman. If you work hard over next 2 months, it may also decide your social mobility down the years. Radiology, you will get very easily married. Anatomy, you will struggle to get married. Right? So this is what is actually the correct situation in the country. So now no one will forget, right? This is, what does this diagram show? Demographic cycle. It has 5 stages. Can anyone tell me names of all the 5 in correct sequence? It is based on, as you can see, birth rate and death rate. First stage, both are high stationary. Second stage, improved medical facility. Population starts expanding, early expanding because death rate declines. Stage 3, birth rate also decline, family planning program, late expanding. Fourth stage, low stationary, both become stable. Fifth is declining. Death rate does not increase, birth rate reduces even further than death rate. So they are asked 2-3 questions. Which stage India is in? Stage 3. So first country to start family planning program in the world, India, has not been able to cross the stage 3. Do we have countries in declining stage was another question. Do we have countries in declining stage? Yes. Majority of European Union countries have population declining year by year. So all Scandinavian countries, From this side of the world, Japan, Russia, it is reducing, Singapore is reducing year by year, right? So this is declining stage. When a country moves from high crude birth rate, death rate to stage 4, low crude birth rate, death rate. This is known as INICT question. Demographic transition. Anyone, what is epidemiological transition? Another question of INICT. Epidemiological transition is communicable to non-communicable diseases. Dr. Vaishu is right. First census, these are all value-based questions, was conducted in the year 1871. First disability census, 1881. Which census India's population reduced from previous census? 2021. 1921. When was the last census? 15th. 11. When is going to be 16th? Actually, it was supposed to be in 2021. When is 16th census going to be? This year. So clear the NEET PG this year, otherwise all the values will change within this year, right? So 2025 16 census, and they are saying now onwards, it will take again at a gap of 10 years. So 2035, 45, 55. So we have to clear this time only. Census stop 1st March, midnight, 00.00 hours is first census stop of India. Sex ratio, formula value highest lowest. Let us see how many of us remember correctly. Formula. Yes, number of females in the country divided by number of males in the country into 1000. Value of sex ratio of India. I'm only telling you those things which have been asked in the paper. 943. So I was telling you our whole country is shameless. So we have only Kerala, Pondicherry where sex ratio is above 1000. Rest of the country is absolutely useless. Daman and Diu lowest. Among states, Haryana is lowest. When we look at child sex ratio, same questions come. Child sex ratio, formula, value. Even highest lowest is not asked. Same formula. But with the age group, female children 0 to 6 years, male children 0 to 6 years into 1000. 919. Highest Mizoram, lowest Haryana. Child sex ratio. So you have to remember formula and value. Even highest, lowest won't be asked. So child sex ratio is only in age 0 to 6 years. Literacy rate. We are asked formula, denominator, value, highest, lowest, definition of literacy. These are the questions. Let's quickly go through it. It is number of literates in our country divided by what is the denominator that was asked. What is the denominator, friends? Yes, total population is 7 years and above. Multiplier is 100. 74% literacy. Highest in Kerala, lowest in Bihar. 82% males, 65% females. Then who is a literate? Again, answer is incomplete. We discussed in the class literacy has to come with complete definition. Yes, it is reading, writing, and understanding any one language of the country. So all three should be present: reading, writing, as well as understanding any one language. What is the growth rate annual for our country? Growth rate is calculated as birth rate minus death rate, that is per 1,000. So divide by 10. India's annual growth rate is 1.64%, making India in which growth phase? Slow, moderate, rapid, very rapid, explosive. India is in which group? Very right. Good to see everyone remembers. Very rapid growth phase, 1.5 to 2%. And what is the expected population doubling time of India? What is the expected population doubling time of India? That is 35 to 47 years. So population doubling time of India. So this values formulae we will have to remember. Class will be over on completion of subject. I think it will go till 12 today, because these are all facts only. Urban population, how much is of our country? It's all a revision for you. 31.3%. Infants are 3%. 10% very high, children below 5 years, and geriatric is above 8%. How much Indian population is pregnant right now? Logically, yes, the number of births or infants, 3%, right? No, we will finish today because tomorrow is meant only for END, only for END. What is the frequency of sample registration system? All these are one word answers. There are no concepts here. Not 5 years, it is once every 6 months, twice a year. Why it is most accurate? I'm looking at the chat box. Almost everyone is answering correctly. Why it is most accurate data collection? Yes, it is. Remember this word. India's only dual record data collection system. It measures infant mortality rate, under 5 mortality rate, neonatal mortality rate, perinatal mortality rate, crude birth rate, crude death rate, even stillbirth rate, even growth rate. Separate report is for MMR. So we have two reports. One report has other indicators, one report has MMR. So maternal mortality ratio has a separate SRS report, but all of them are measured in sample registration system. National Family Health Survey, once every 5 to 6 years. How many rounds have been completed? That was the question. 5 rounds. National Family Health Survey 5 results are already available. This tells you district level household survey. So question was, district level immunization coverage levels are assessed in which healthcare system or health data collection system? District level household survey. Vital registration system. Birth should be registered within, death should be registered within. Two common questions. What is the answer to these two questions, friends? Absolutely same for both 21 days, 21 days. Also in India, mandatory is marriage registration, different in different parts of the country. 30, 60 for 90 days. Birth registration is responsibility of parents, doctor, or hospital. Yes, hospital. Hospital means wherever delivery has taken place. If subcenter, subcenter. If PHC, PHC. Child born to NRI couple abroad, birth registration must be done within how many days of arrival in the country? It is within 60 days of arrival in the country. Good. TFR, GRR, NRR. Can you answer in 2 to 3 words? What is the difference? Total fertility rate is total number of children born to a woman or a family or a couple. Gross reproduction rate. Total number of girl children. net reproduction rate, total number of girl children minus mortality. Living girls, you can say. Yes, net reproduction rate. TFR is also known as completed family size. What is the mathematical relationship between birth rate and TFR? What is the mathematical relationship between birth rate and TFR? Yes, very right. Crude birth rate is 8 times total fertility rate plus 1. Approximate relationship between these two. Right. Child woman ratio. Total children 0 to 4 years per 1000 women in reproductive age. GFR. I'm only discussing those which have been asked, so it's not too much. It is the minimum we have to revise before the exam. General fertility rate. Total number of live births. Again, denominator is same, women in reproductive age, mid-year population also, in 2000. Then you must have seen last 2 years continuously the question is coming on calculation of dependency ratio. Let's look at that. Dependency ratio is non-earning by earning population. So below 15, more than 65 is non-earning, and rest of the population is taken as earning. Can you calculate dependency ratio in the question given? Can you calculate dependency ratio in the question given? Yes. Now look at the question carefully, friends. 30% population is children below 15, 10% more than 45 years. So more than 65 years. So what they have given is numerator to you, children and older people. So how much will be denominator? If 40% is numerator, rest of the population has to be denominator. 2 by 3.66. So this is the interpretation. 66 non-earning depend on 100 earning for survival. So they will give you in decimals, but you have to interpret as numbers. 66 non-earning depend on 100 earning for survival. Another way of saying same thing. 100 earning are supporting how much population in this district? 100 earning are supporting a total of 166. Very right. 100 themselves and 66 non-earning. Good. Population pyramid is which type of statistical diagram that we have discussed today? Population pyramid, if you look, this is which type of statistical diagram? Double histogram. Why double? Both male females are represented on same diagram. And I told you, make a rule of your life, females are always right. So females are always on the right side of this diagram. We have to remember. Now, how questions come in our paper? They ask you technical words, or they can give you a diagram and then ask you to compare developing and developed country. First, we look at number one, shape. When we look at shape of a developing country, you have to remember some words. This is an upright triangle having broad base, narrow top. A very logical question. Why there is a broad base in a developing country? More children, high fertility. So shape represents fertility pattern. So it will be high in developing, low in developed. In low fertility or developed countries, what is the shape of a population pyramid? Look at this carefully. It is like this. So this is technically known as spindle shape. having a bulge in the middle. You have to remember these words, friends. So I'll repeat. Upright triangle, broad base, narrow top. High fertility developing country. Spindle shaped bulge in the middle. Low fertility developed country. Span. Span, if you look, is height. Low span in developing, high span in developed. Why? Span represents. What does span represent? Is life expectancy. Obviously higher in developed countries. If you look at symmetry, you will find gap here. So developing countries have asymmetric pyramid. We have just discussed short while ago why it is asymmetric. We have lesser females due to female feticide. So symmetry represents sex ratio. This is symmetric in developed countries. So shape, span or symmetry, one of them will be asked in the paper. We come to health planning. Definitions and committees are asked. Objective definition has been asked. This is specific pre-planned activity in a health program. Okay, so if you say we can have a break of 5-7 minutes, it's not a problem. It's up to you. We need another 45-50 minutes to wrap up. Okay, so let's go for a break of 10 minutes. Then we'll reassemble and restart. 11:08. Let's come back by 11:15, right? Okay, let's go for a break. No, no, let's have a break because students also need a break. But we will cover because idea is to cover 100% of the course as much as possible in a short duration. It will be a good revision. Then you don't have to spend time again and again on PSM, right? Okay. So let's go for a small break of 7-8 minutes. We'll come back. ओके फ्रेंड्स, स्टार्ट करें दोबारा से। लास्ट सेशन लेट अस स्टार्ट। प्लानिंग पे आ गए। सिर्फ प्लानिंग से एक ही क्वेश्चन आएगा। देयर विल बी ओनली वन क्वेश्चन आइदर फ्रॉम द डेफिनेशंस और द हेल्थ प्लानिंग कमिटीज. So any specific pre-planned activity in a health program, and what is goal? Ultimate desired state. And target is achievement of objectives with timeline. Which of them show all or none phenomena? Goal. Which of them is not generally constrained by time? No time constraint is for goal again. You may say we will achieve this by this time. Ultimately, we will eliminate tuberculosis. So it may happen anytime. It may happen in next 2 years, 5 years, 20 years, right? So there is no time constraint. Then smart objectives. What are smart objectives, friends? It is an abbreviation. See, whenever you make an abbreviation, it should be SMART. What is the full form of SMART? Anyone remembers? This is specific, measurable, appropriate, relevant, and time bound. Specific, measurable. Please make a note in case you are not having this. Specific, measurable, appropriate. It should be relevant, and it should be time bound. 5 qualities of a good objective or a smart objective. So same mnemonic is used. Now all questions come from health committee. Can you tell me what are the important recommendations of 4 committee? Class will take another 1 hour maximum, 12:15. We should let's keep as the target because we are moving fast. All are fact-based questions. Yes, important contributions PHC 1 per 40,000, 3 million plan. School health we discussed. Comprehensive health care and social physicians. 3 months internship in PSM. Balwant Rai Mehta committee. Only one question has been asked, so we will stick to one question. Panchayati Raj institutions in the country. Renuka Roy committee. School health. There were more recommendations, but focus on school health. Meals in school was also recommended by Renuka Roy. Modular committee. Board committees, health survey and development committee. This is health survey and planning committee. Modular committee recommended same PHC 1 per 40,000. All India health service like IAS service. Very right, Dr. Himanshu. Chadha committee. Basic health worker. Mukherjee committee. Basic health services. Jangalwala committee. Integration of health services. Equal pay for equal work in medicine. And it recommended ban on private practice by government doctors. So we are only discussing those recommendations, friends, which have been asked in the exam. So all of you are correct when I'm looking at the chat box. Kartar Singh, most popular topic. What is the major recommendation? It introduced in India. multi-purpose worker. It also introduced health supervisor at CHC, but multi-purpose worker. Srivastava Committee, Group on Medical Education and Support Manpower. It gave important recommendations of Rome scheme, introduced village health guide, health assistant at PHC, referral services complex, PHC to CHC to medical college, and bands of semi-professional, para-professional health workers. I will use a lot of abbreviations because we have to finish even faster. Krishnan Committee, Urban Revamping Scheme. So urban areas was never a focus earlier, but now it came into focus. Yes, Dr. Anjali, you are right. Bajaj Committee, Health Education Policy. It recommended. Health Manpower Policy, it recommended. INI-CT has asked high-level expert group committee, what were the two important recommendations? Universal health coverage and 3.5 year rural graduate MBBS course. High-level expert group committee, right? So this is an additional slide. High-level expert group committee. So this is a small chapter, health planning, revised in 5 minutes before the exam. So this is the importance of smaller chapters. We know one question we are making correct. Health communication. Now, barriers to communication, friends. What are the different types of barriers in communication? This topic I'm telling you because it was asked for the first time in your exam. So this includes physical barrier. Physical are same as environmental barriers. So what will this include? Environmental barriers. Heat, cold, poor light, poor visibility. So communication suffers in that. Psychological barriers in communication. Psychological barriers include illiteracy, ignorance. If there is no trust on a person, that will also come in psychological. Then is cultural. Cultural type of barrier occur due to customs, beliefs, practices. So again, it will act as a barrier. Then we have technical barriers. Technical barrier is using some other language. Suppose your patient do not understand English and you're talking to them in English. This is a technical, also known as linguistic barrier. Otherwise, the media you are selecting. Now, the latest question was on semantic barrier. It is not a language barrier. Language barrier is someone is talking to you in French and you don't understand French. That is linguistic language barrier. What is semantic? Few words unable to understand. Otherwise, you are understanding everything. Remember, by the example I am telling you, you will never forget. You're talking to a girl, you propose to her, she tells you, I do not love you, but you don't hear the word do not. Right? So I don't love you, may you don't hear the word don't selectively. This is a semantic barrier of communication between you two, right? Okay. Everything else you are able to hear. So this is semantic barrier. Which health communication method this is? शशि थरूर को तो अपनी लैंग्वेज समझ में नहीं आती, हमें क्या समझाएगा? दिस इज lecture. One person addressing an audience. Is it didactic or Socratic? One-way communication or two-way communication? Yes, this is one-way communication didactic. All politicians are same. They don't know what they are speaking most of the times, right? So lecture is didactic, one-way communication. Ideal group size should be. Yes, ideal group size should be less than 30. Ideal duration should be less than 15 to 20 minutes. Okay, that is also correct. Right, so just imagine PSM crash course, ideal duration of lecture 15 to 20 minutes. So both of us will just list the names of 20 chapters or topics and the class will be finished, right? So that is lecture, not a good method. This is a type of focus group discussion. Discussion among how many people? That was the question latest. 10 to 12, no, it should be 6 to 12. Yes, see, lecture, it is not that some book is saying 40, some are saying 30. They said ideally it should be less than 30. Some books may have written 40 also, that is correct. So 6 to 12, focus group discussion. When this discussion is carried out, the recorder has to make a graph of interaction between the participants. What is this graph of interaction known as? This is known as sociogram. Right? So sociogram is interaction between participants in a focus group discussion. Which focus group discussion is better? First or second? It is second because it is more balanced, right? So this you can say is when we discuss in a class. This is not good because when we are discussing something in the class, this is your national board of examination. Sitting in the corner, drinking alcohol, making questions. So sociogram, every member should get an equal chance of participating in the discussion. Then it will become more healthy, right? This is a type of panel discussion. Why do you say it is panel discussion, friends? What is the key feature you can see in the image also? Yes, it is a panel of experts in front of audience. How many experts should be there? 4 to 8, good. And didactic, Socratic. Socratic. This is also Socratic. Discussion always will be Socratic, right? Two-way communication. This is yes, role play, socio-drama. Ideal audience size should be big or small. It should be small, ideally less than 25. One-way or two-way communication, didactic or Socratic? Okay, some are saying one-way, some are saying two-way. Think about the method, think about the role play. It is Socratic two-way. Once the play is over, audience may have questions theater professionals cannot answer. So medical officer of nearby PHC or doctor or health workers, they will address to the questions of the audience, role play, right? So we have universities in India where 100% of the times they do this, right? So this is role play or socio-drama. Thankfully, our medical colleges are not like that. This is a This is a demonstration. Sugar salt solution preparation, ORS preparation. What are the two principles in step-by-step technique of demonstration? Two principles, very right. Learning by doing. So it becomes Socratic. And what is the other method? Yes, Dr. Yashri is right. Seeing is believing. So once they see, they believe, okay, this is possible, doable at home also. And then they repeat the steps in front of you. That is learning by doing, Socratic. What is flannel graph? Anyone? If only definition was asked. No, flannel graph is not poster. It is series of photographs pasted on a piece of cloth in sequence. Life cycle of Plasmodium or anything. Didactic, Socratic. Flannel graph is a one way. Didactic. What is the use of spikes technique in health? कहाँ पर use करते हैं? Where do we use spikes technique, friends? Bad news. It is generally used for communication of cancer diagnosis or prognosis. But you are actually right. Any bad news communication. It is actually an abbreviation. Set up interview, assess perception, invitation to explain. What is K? What is K? Knowledge. Give them knowledge about the cancer. They may show emotions. Again, as a doctor, surgeon, give summary strategy. One way, two way. Didactic, Socratic. Socratic. Best use has been found in communication of breast cancer diagnosis, prognosis, communication. What is the use of gather approach in public health? And what is its older name? Two questions. It is used for contraceptive counseling, you are right. Earlier known as cafeteria approach. Greet the couple. Ask them about their contraceptive requirement. Tell them about available method. Help them choose the method suitable to them. Explain usage. If failure occurs, what to do. If side effect occur, what to do. If they've understood, expect a return visit. So two abbreviation based topics very favorite of NEET PG examiners. Gather approach and spikes technique. Arrange in sequence. Yes. So first is awareness. Then interest develops in that thing. Then you evaluate how it is going to help. Then you do a trial and finally you adopt. Right, very right. Mnemonic ITA, awareness, interest, evaluation, trial, adoption. Adoption is the last thing. Example could be like hand washing to prevent COVID. So adoption of a new idea practice, right? Okay. Health education versus propaganda. What is the answer? Education appeals to, health education appeals to reason. Person will try to understand. Health propaganda appeals to emotions. Thought process, knowledge development is present in education, absent in propaganda. Processes are behavior centric. You have to remember these words, friends. It tries to alter the behavior. New skill is developed. Whereas in propaganda, it is information centric. They just try to sell the product based on information. Yes, very right, Dr. Mitali. Behavior in education is reflective. Like in hand washing, it will reflect in the behavior of the person lifelong. Health propagation, person buys the product in a reflexive behavior, you have to remember. Impulsive, you can say impulsive is also correct. Very right. Height increasing products. Management, another small chapter. Can you tell me how benefit is different from effectiveness? In one word, how is benefit different from effectiveness? Yes, benefit is money or monetary benefit. By running a program, how much money government of India is saving? By giving vaccination, how much money government of India is saving? Effectiveness is results achieved. How many human lives are saved? How many deaths are prevented? How many hospitalization days are reduced? Yes, this is measured clearly as the best indicator of cost effectiveness. Quality adjusted life year. What is systems analysis? Anyone? No, it is not PERT. Dr. Dulam is right. It is comparison of two or more cost effective alternatives. So two techniques for diagnosis. One is for 100 rupees, one is for 200 rupees. You can compare cost, but look at the results also. What is the sensitivity of this test? What is the sensitivity of that test? And then choose the better one in the program. This comparison is known as systems analysis. This is what you were saying. Part of network analysis. What is PERT? Program evaluation and review technique is actually sequence of activities. And what is the most critical path in that? Longest path. Longest in terms of duration of activities or the number of activities. Longest duration. So if there are, let us say this as the path number 1. We discuss, I think, same example. Path number 2. Path number 3. What is critical in this program? Which has the longest duration? You can count also by looking. Yes, path number 1. Now, friends, in one of the recent papers, they asked the same question by a new diagram. This was the exact question. National Board. Suppose I ask you, this is your first path. This is your second path. Which is the critical path? If you look at first one, 4, 2, 1 and 1, 8 months. Look at second path, 2, 10 and 1, 11 months. So this is your critical path. So I hope this concept is clear. Longer the duration, that is most critical for the success of the program. Right? Okay. But when they ask this question this time, actually, they didn't ask the complete path. Can you tell me which is most critical path? If you look at the activity, can you tell me? This was the exact question. Which is the most critical component in this? That was the question actually. Good. It is installation of equipments is the most critical. So if they don't ask you the complete path, activity which takes longest duration, equipment installation, that is the critical path for the success. This diagram was taken from Park textbook for the first time, right? So we have to remember. Cost accounting is financial and resource allocation. Which component of money will go into which component of the program? What is zero budget approach? No fresh budget on 1st of April if previous is not zero. Not zero means not spent by 31st of March. So if your previous budget is zero by 31st March, then only you will get budget for the next year. Absolutely right. What is work sampling? Sampling to assess quality of work in a hospital. So it is used for doctors, nurses, hospital staff also. What is the full form of SWOT? Anyone? Strength, weakness, opportunity, threat. So every program we make a list. Strength, weakness, opportunity, threat. Now, when you look at ABC analysis, it is based on budget and number of items. Now, if you see 10% of items consume 70% of budget, 20% items, 20% budget, but majority of things are very cheap in a hospital. Paracetamol, ORS, tetracycline, doxycycline, penicillin are very cheap. Yes, it is an abbreviation, always better control. VED, full form was asked. What is VED? Vital, essential, desirable. Absence of vital drugs cannot be tolerated. Life-saving drugs. Essential drug for some time you can manage. Desirable for long time you can manage. Absence, we are talking of absence, whether we can manage. Genetics, what is this, friends? A logo of Human Genome Project. 1990 to 2003. It wanted to do complete sequencing of human genome. That has been achieved. We know now we have 19,500 genes and 3 billion base pairs. There two older techniques, classical techniques were used, Sanger technique and Maxim Gilbert. This was the question in the exam. So not modern chain termination techniques, but older. Yes, Dr. James T. Watson was the initial head of this particular project, Human Genome Project. What is this? Anyone? Hardy-Weinberg law. Two questions. What is the definition? Number one. Definition is frequency of genes remain constant from one generation to another. Second question. It is only applicable to which population? If it is large, if it is static, and if it is random mating. Opposite situation, it will not be applicable. INICT question. Mendelian cross breeding experiments. This is known as predicting the genotype of offspring, Punnett square. So Mendelian cross breeding experiments, you can predict the genotype of offspring, Punnett square. What is euthenics? What is eugenics? One word answer. What is euthenics? What is eugenics? Yes, answer actually lies in the word itself. Answer actually lies in the word itself. Euthenics is environmental manipulation. Eugenics is genetic manipulation. Environmental, like disabled friendly school. Eugenics, genetic manipulation, gene therapy, etc. Mental health, only two questions. What is the most common mental health disorder in India? Best answer. Depression. Is it unipolar more common in India or bipolar? Unipolar. So unipolar depression is most common, followed by alcohol disorders, schizophrenia, bipolar. Suicide, two questions. What is the current rate in the country? What is the most common mode? Yes, rate is 12.4 per 1 lakh population per year, and hanging still continues to be the most common mode of suicide. You have to remain calm, right? At least if not from inside, at least from the surface till the exam, you have to remain calm. It depends. I have not seen the latest NCRB data, Dr. Zeiss, but generally higher suicide rates, higher suicides have been reported from Kerala, Sikkim, Vidarbha region states. Maximum suicides have been reported. I'll have to see if ranking has changed recently or not. If ranking has changed recently or not. Okay, this is Capri Island. Italy, it is one of the best places to go to whenever you get chance. Please go, right? We come to diseases. This will be interesting because now it will test your clinical knowledge also. Measles incubation period 10 to 14 days. What is the single best answer if I have to mark? 10, 12, 14 or 16? It is 10 days. First symptom fever starts on 10th day. Rash starts on 14th day. Diphtheria incubation period 2 to 6 days. Which other disease incubation period is 2 to 6 days? Yellow fever. Quarantine period of yellow fever 6 days. What is the influenza incubation period? 1 to 3 days, 18 to 72 hours. Food poisoning, you have already told me for staphylococcus. Okay. Hepatitis A, hepatitis B, incubation periods. Yes, good. 15 to 45 days. 2 to 6 weeks hepatitis A. 45 to 180 days. 6 weeks to 6 months hepatitis B. Ebola, anyone remembers incubation period without looking at notes? 2 to 21 days. Can you tell me period of infectivity for chickenpox and measles? We remembered the mnemonic. Anyone remembers? Chickenpox 25, measles 45. So chickenpox 2 days prior to appearance of rash till 5 days later. Measles 4 days prior to appearance of rash till 5 days later. Tetanus. What is the period of communicability? None. Because it is not communicable from man to man, it is only communicable from soil to man. What is the pathognomic clinical feature of diphtheria? Is it bullneck or is it pseudomembrane? It is, yes, bullneck appearance. From a distance, you can make a diagnosis. Rabies. What is the pathognomic clinical feature? That is hydrophobia. What is the pathognomic microscopic feature of rabies? Negri bodies. Measles. What is the clinical feature? Pathognomic. Pathognomic means if you see nothing else is required for diagnosis. Koplik spots. What is number one? What is number two? So I'm looking at exam questions now. Which disease? Make a diagnosis. Yes. One is smallpox. Two is chickenpox. Chickenpox, three features. Distribution is centripetal for rash. Rash is pleomorphic. What is the meaning of pleomorphic rash, friends, in chickenpox? All stages seen at same time in same person's body. So macule, papule, ulceration, swab, all will be seen at same time. And third has been shown in the image. Dewdrop on a rose petal appearance. So when you will propose to your girlfriend with a rose, with a dewdrop on that, she will tell you what is pleomorphic rash. So this is chicken pox. Three important features that you have to memorize, right? Okay. Make a clinical diagnosis by looking at the images. These images have been asked in your paper. Yes, this is herpes zoster or shingles. How did we recognize this? It is a characteristic dermatomal distribution, very painful. Do we have a vaccine to prevent this? Do we have a vaccine to prevent this? Yes, we discussed live attenuated OCA strain is now available for zoster also. Can you make clinical diagnosis which disease and what is shown in the image? Yes, this is disease measles because actually what is shown is its pathognomic clinical feature, Koplik spot. If you look carefully, bluish white spot, opposite not third, opposite second molar, not third molar, opposite second molar is Koplik spot. Now, Koplik spots are generally not seen in clinical practice. Why? UPSC question. Koplik spots disappear 2 days prior to appearance of rash. So many times, almost always, we are never able to see them because mother will bring the child to you when rash appears on the body. But Koplik spots are gone. So how do you diagnose measles then? How do you diagnose measles then? We look at history by the mother that child had retroauricular origin of rash. So she'll tell you it started behind the ear pinna, came to face, moved downwards. Incubation period we have done. What is the secondary attack rate of measles? Yes, is above 90%. Clinical features we have discussed, Koplik spot, retroauricular, along with that conjunctivitis congestion like situation is there, running nose, coryza is there. What is the most common complication of measles? Yes, serous otitis media. What is the late complication of measles? SSPE, subacute sclerosing panencephalitis. It is also rare also. What is the most common cause of death in measles? We are talking of Indian situation. No, pneumonia is not the commonest cause of death. It is secondary bacterial infections. If secondary bacterial infection is not in the choice, then you mark pneumonia. Because actually in pneumonia we are able to manage. But when secondary bacterial infection occur on pneumonia, then the child dies. So measles, which developed countries used to laugh on developing countries, that measles is causing death in your country, situation is now reversing. Measles has started appearing as a cause of death in the world in developed countries. Another 20 minutes we are wrapping up. Make a clinical diagnosis. Disease, mumps. How did you diagnose clinically by looking at this picture is most common. No, it's not bull neck. Bull neck is in diphtheria, not in mumps. Most common body part affected is salivary gland, especially parotid gland. Myxovirus parootitis. What is the most common complication of mumps? No, it is not orchitis, friends. We have discussed orchitis is in adolescents. Mumps is more common in children before adolescent. It is aseptic meningitis. Let me repeat. In children 5 to 9 years, aseptic meningitis. In adolescents, it is orchitis in male, oophorytis in female. In older adults, it is meningoencephalomyelitis. It affects all ages. But because maximum cases are in children below 9 years, so whatever the most common complication of children below 9 years, that will be the most common complication of mumps. So mark orchitis only when they ask you adolescents. Otherwise, you have to mark aseptic meningitis. Make a diagnosis. Congenital rubella syndrome triad consists of patent ductus arteriosus, heart defect, cataract, sensory neural deafness. Which trimester it has highest chances of transmission and it is most dangerous? First trimester. Which is the first priority group for rubella vaccination in India? Older, very old question, but I wanted to tell you. First priority group of vaccination is 15 to 49 non-pregnant, non-lactating women. Why we are saying non-pregnant? Rubella is a live vaccine contraindicated in pregnancy, right? Okay. So this is first priority group for vaccination. Make a clinical diagnosis. Which disease we are talking of when we look at these images? Diphtheria. What is the appearance shown in microscopic picture? Chinese or cuneiform? What stain is used in Indian program which shows green colored bacilli? Albert stain. When we look at this Chinese letter, you find these bodies known as Volatin granules, Babe Ernst granules, polymetaphosphate granules, and metachromatic granules. All four are same. Immunity status test of diphtheria, which is not used nowadays. Immunity status test of diphtheria, which is not used nowadays, is Schick test. Heme agglutination inhibition test has replaced Schick test. Heme agglutination inhibition test has replaced Schick test now. What is shown in the image? Montu test. Immunity status test for tuberculosis. Quickly tell me these questions which are asked. Antigen, dose, route, site, strain. When do we take reading? Antigen used is purified protein derivative, tuberculin unit. How much dose is used in India? 1 tuberculin unit in 0.1 ml. Intradermal flexor aspect of forearm. Look at this image. Intradermally flexor aspect of forearm. All immunity status tests are given in this only. What is the strain of PPD? Anyone? Good, Dr. Yashri is right. RT23 with twin 80. When do we take reading, friends? Yes, after 72 hours. Which type of hypersensitivity reaction this is? Which type of hypersensitivity? Delayed hypersensitivity type 4. Make a diagnosis. This is mucormycosis. Common language, wrongly it was known as black fungus. So it's not boyfriend, it is black fungus. How do you identify by its clinical, this picture? How did you identify? Yes, it is aseptate ribbon-like hyphae which branch at 90 degree, known as antlers on moose appearance. Antlers on moose appearance. Drug of choice. Just like Kala-Azar, lamb. What do you see on CT scan? What do you see on MRI? Indian program has categorically mentioned. On CT scan, you see bony erosion and mucosal thickening. Nasal turbinate sign is visible on MRI. So excessive use of steroids in COVID-19 led to revival of this disease in the country. Mucormycosis. Can you tell me in hepatitis B serum marker, what is the epidemiological marker? It is hepatitis B surface antigen, also known as Australia antigen. What is marker of infectivity? Yes, hepatitis B envelope antigen. Which of them is used in preparation of mosquirisk? Let's revise from yesterday. Yes, surface antigen is used to prepare mosquirisk vaccine also. Which of them is generally seen in vaccinated individuals, people who have received hepatitis B vaccine? Yes. Which of them is seen in acute hepatitis B stage? Acute hepatitis B. Yes, IgM. Chronic stage IgG. Which of them indicate active viral replication? E antigen. Right? Good. Make a diagnosis. Why you are saying typhoid? This is, friends, I'm only showing you images asked in your paper. Why this is typhoid? Yes. Step ladder pattern. So daily 0.5 to 0.6 degree increase. Very right. Diagnosis is by Basu. Blood in first week. Stool second week onwards. Sorry, antibodies Vidal second week onwards. Stool third week onwards. Fourth week. Clinically, patient, you are right, presents with pea soup diarrhea, rose spots. There is coated tongue also, and there is a chances of intestinal perforation in which time? Intestinal perforation, when do we have to be careful? Early part of third week. Specific question, specific answer. Early part of third week. Salmonella typhi. WHO ORS, what is the content composition? We have sodium chloride 2.6, potassium chloride 1.5, sodium citrate 2.9, and glucose 13.5. So total weight of ORS packet is 20.5 grams. It is dissolved in 1 liter of water. Used within 24 hours. Ionic concentration generated 75 millimoles liter of sodium, 20 of potassium, 65 chloride, 10 citrate, 75 glucose, 245 millimoles per liter. How many of you remembered all these values correctly? Because this was asked in the paper, especially the upper four. Good. So many of us were able to remember. If you get a time or choice in the exam to zoom out, actually everything is written in the slide also. So everything was written in the slide, but you have to carefully look in the exam also. Right? So this is content composition of WHO ORS. Make a clinical diagnosis. Then I'll ask you questions. This is make a diagnosis of the disease. Dr. Ishan is right. Hookworm. Ankylostoma duodenale, Necator americanus, penetration of skin of foot, Laiva migrans. How do you assess problem of hookworm in a community? We use Chandler index, which is number of eggs per gram of community stool. Hookworm is a major public health problem if Chandler index is more than 300. Kato-Katz's technique. It is associated with iron deficiency anemia. Roughly around 0.1 ml blood loss per worm per day. And what is the drug of choice for hookworm in India? Roundworm also it is same. Roundworm and hookworm. Albendazole. Okay. Then we look at this. This we will take time because we have to mark causative agent, vector, reservoir. 100% one question will come from this. So let's first look at causative agent. Epidemic typhus is caused by Rickettsia prowazekii, Rickettsia typhi, scrub typhus, Rickettsia susugamushi. This is Rickettsia connori. RMSF Rickettsia rickettsii and Rickettsia akkari. Okay, let's keep on highlighting questions of your paper. Then you will know, okay, so many questions are asked. Of Q fever. Let us see how many remember. Yes, you are right. Coxiella burnetii. And this is Bartonella quintana. Vector, when we look, louse. No vector here. So we are again looking at your exam questions. This is flea-borne typhus. This is trombiculid mite. This has been asked in INICT. Then this is tick mite. Here, man, first and last man. For Q fever, it is cattle. Others, it is rodents. Friends, there is no shortcut to this table. Please revise it before the exam. 100% one question will come from this table. And what is the recrudescent form of epidemic typhus is? Brill-Zinsser disease. Brill-Zinsser disease. Let's move forward. What is the validity of yellow fever vaccination certificate? Strain we have already discussed 17D, live attenuated. Yes, 10 days to lifelong. Very right. Which disease are we talking of? Japanese encephalitis. What is the role of man? What is the role of pigs? Man is accidental dead end host. And pigs are amplifier host. Vector we have discussed Culex tritinuricus. Ardite birds are the actual host. For Japanese encephalitis, horses and cattle are mosquito attractants. Make a clinical diagnosis. Culex vishnui gelidius are in very small parts of southern India. You are right. This is trachoma. What is shown in first image? Large follicles. What is shown in second image? Limbal follicles. Herbert Pitts. What is the drug of choice of this disease which has been eliminated on 8th October 2024? Single dose azithromycin. 20 milligram per kg. Prevention and control strategy is known as SAFE. Surgery, antibiotic, facial wash, environment. Surgery is for two conditions in trachoma control. What are those, friends? Two conditions where surgery is allowed. Trichiasis, very right, and entropion. We quickly come to non-communicable. Can you tell me which disease and what is the name of this phenomenon? Yes, rule of halves, which is only shown by hypertension. Can you tell me what is innermost black circle? Latest question. Innermost black circle. No, not treated. Not treated. Yes, very right. Adequately treated. So we have total population blue, 50% yellow develop hypertension. Out of those 50% green become symptomatic. Out of those 50% seek treatment, red. Out of those 50% get adequate treatment. That was asked innermost circle. Also shown by same disease tracking phenomena. What is tracking phenomena? Hypotensive remains hypotensive in life and hypertensive remains hypertensive. So BP increase with age, but those on the lower side remain on lower side, those in higher remain on higher side. Yes, Kohli, hyper, Dhoni, hypo, right? Okay. Obesity, body mass index, weight upon height square kilogram in meter. This time calculation will come. Ponderal index is height divided by cube root of body weight. Height minus 100 is Broca. Calculation will only ask from BMI. Actual weight upon desirable weight. So which of them is height independent? Which indicator of obesity does not depend on height? One is corpulence and one is skin fold thickness. Which is weight independent? Skin fold thickness and Broca. Which is both height and weight independent? Is skin fold thickness. Very right. Then detail is asked about these, not all, only from BMI and skin fold thickness. Body mass index, 4 categories. We have underweight, normal. You have to remember them. Question will come this time. Overweight, pre-obese, and obese. Can you tell me what is normal body mass index globally? Yes, 18 to 25. 25 to 30 is pre-obese, 30 and above is obesity. 3 questions have been asked. Underlines are the questions of your paper. Percentile classification, who is obese? This was asked. Anyone who has body mass index percentile wise above? What is the answer, friends? Yes, 95th percentile. Good. 85th to 95th. 5th to 85th. Underweight, normal, overweight, obese. This cutoff 95th was asked. Indian, they have never asked. Just to complete, 18.5 to 23, 23 to 25. So underweight is same. Normal is till 23, 23 to 25. Overweight, 25 above is obesity. What is this instrument for skin fold thickness? Herpendon calipers. Which 4 sides of the body it is used to measure? 4 sides of the body. We have skin above biceps, triceps, suprailiac, subscapular. Triceps is most sensitive. Total more than 40 millimeter in boys, 50 millimeter in girls is obesity. Triceps wise, more than 18 millimeter in boys, 32 millimeter in girls is obesity. Which level of prevention is Herpendon calipers? This is secondary level. Lastly, international health, established WHO 1945. Yesterday was day before. Day to day before, we have entered the third day. 1948 Constitution. Headquarters, Geneva. Bodies, there are 3. World Health Assembly, Secretariat, and Executive Board. 3 bodies are there. UNICEF. Okay, I am presuming all of us know this. This is World Health Organization logo. 2 logos are asked and UNICEF is asked. What is C in UNICEF? Anyone? C. Is it child or children? It is children. Very right. Headquarters are in New York. What is O in Gobi campaign? That was the question. Healthy beginnings, hopeful future. So growth monitoring, ORS, breastfeeding immunization. What is triple F? Family planning, food supplementation, female education. International Labour Organization, again Geneva. Food and Agricultural Organization, Rome, Italy. So they've made their headquarters in the best possible countries and cities. Which health programs they are supporting or what they are doing? What is their contribution? This is RCH program, UNFPA RCH program, family planning, SIDA, TB, Danida, blindness. And what is the contribution by Colombo plan in the Indian healthcare system? Anyone? Latest question. Good. Cobalt therapy units in medical colleges. It also helped in establishment of AIMS at Delhi. Cobalt therapy units. Sustainable Development Goals given by United Nations. Total of 17 goals. Target year 2030. How many goals are directly health related, friends? Yes, one goal, that is goal number 3. Target 3.1, you told me yesterday correctly, MMR below 70. Under 5, 3.2 below 25. Neonatal mortality rate below 12. Absolutely. Category A, most dangerous, includes 6. Which are those 6, friends? Smallpox, which is overall most dangerous. Anthrax, which is most commonly used. Botulism, I'm saying questions one by one, which is most lethal quantity wise. Then we have plague, tularemia, that is Francisella, and viral hemorrhagic fever, Ebola, Marburg, and Lassa virus. Category C, new emerging pathogens. This includes Nipah and hantavirus. I told you COVID is not a bioterrorism agent. Less dangerous. This is a long list. Epidemic typhus Q fever, food safety threat, water safety threat, melioidosis glanders, psittacosis, brucellosis, and it will include all types of poisonings and staphylococcal food poisoning also, ricin toxin also. Which diseases are WHO notifiable? They have to be notified within 24 hours. What are the 4 diseases? Mnemonic we remembered. Polio, wild polio, that is. Human influenza, smallpox, and SARS. Air travel in pregnancy is permitted up to what period of gestation? No, Zika is not immediately notifiable. We are talking of immediately notifiable. It is within air travel is permitted up to 36 weeks. If it is twin pregnancy, 28, 32 weeks. EDD certificate, you are right, should be carried after 28 weeks. What is emporiatrics? Study of health of international travelers is known as emporiatrics. Thank you, friends, so much. I know we got so much time only, but this was the best possible I could have done in those 12 hours that I got, right? So please study PSM well. INI-CT will be slightly troublesome, but NEET PG will give you definitely 22 to 23 questions out of 200. You have to attempt 18 correctly, right? So if you get tired, learn to rest. So someday you are feeling very tired, don't worry, sleep well, take rest, take a break. But idea is to not quit till the exam. Keep on working hard. Keep on working hard. Right? So thank you so much, friends. I wish you all the best. Tomorrow we will have a END discussion at 5:30 p.m. I think I have not seen the time. Is it 5 p.m. or 5:30 p.m.? What I will do is 75 questions I have to prepare. I will keep around 50 questions from what we have discussed, 50 to 55, that everyone you have to attempt correctly. But I will like to include those 20-25 questions also that either we have discussed very little or that we were not able to discuss at all. Idea is to not give everything from the last 2 days so that you feel overconfident. Idea is to help you realize course never finishes, but we have to do as much as possible. Thank you so much, friends. I actually enjoyed this session. मुझे तो जब भी पढ़ाने का मौका मिलेगा, I will not stop. This is my problem, but this is what I love. Right? So this is a very small village in interiors of Switzerland, in Italy rather, Leno. Switzerland, sorry, part of Switzerland only. Leno is a very small village in that. So whenever you get time, do go there. One of the most peaceful parts in the world. Actually, the sound decibel level was 20 to 35, which we need in our hospital wards, right? Thank you so much, friends. Keep on studying, keep on working hard. There is no shortcut to success. इतना पैसा कैसे कमाया जाता है? It's not about money. You work hard, money will come. Money will come, and doctors are supposed to earn money. Once you give 7 to 10 years of your professional career some hard work, then money will not stop, right? Spending money is the thing, earning is not. You should be ready to spend, right? Okay. Emporiatrics is defined as study of health of international travelers. Study of health of international travelers. Thank you so much, Dr. Suchita. Right? Yes, we can say this is enough as a revision because the 45-hour course we have done in 11, 12 hours. So this is sufficient to revise. Who clicks photos? My daughter is always along with me. My wife is always along with me. So we always travel together. One kid, one daughter, only one kid. Countries, same 45. I'm now repeating countries. This was my second visit to Switzerland, second visit to Italy. So this time I went into interiors. There was no vegetarian food available, but that won't stop us from traveling. Africa, I've been to Seychelles, I've been to Mauritius, I've been to. Avoid that answer. My daughter doesn't want to be on social media, so she never comes on social media. She feels it is a wastage of time for students. She's much younger than all of you. Yes, I will come, Dr. Vasu. Thank you so much. Masai Mara is, I have to come. I have to come. See, if some backlog is there in the study, don't worry at all, Dr. Suchita. Never ever we will be able to finish the course, but try to do 85 to 90, 80, let's keep it 80, 85% of all subjects. That will be easier. That will be easier. Revision is the key. Revise, revise, revise. Don't worry about what is left behind. हो सकता है उसमें से एक भी क्वेश्चन ना आए जो आपका छूट गया. Yes, I've been to Bhutan. Paro, I've been there. Thimphu, I've been there to Bhutan. The main course at this time, rapid revision videos you will have